Good evening, everybody, and welcome to this event on behalf of Sheffield Teaching Hospitals. I'm Michael Harper, Chief Operating Officer. Really appreciate that you've given some time tonight to join this event. We are expecting over 150 people at this event, so we're really pleased about the enthusiasm and interest that there is. The aim of this event is to talk through the different roles that we have here, management roles that we have here at Sheffield Teaching Hospitals, to give you an insight into what being a manager at Sheffield Teaching Hospitals is like, and the opportunities that Sheffield Teaching Hospitals can give you in a management role. We know from the people that have signed up so far that we've got quite a broad audience. We've got some people from within Sheffield Teaching Hospitals who are interested either into moving into a management role or moving on to a different management role. We've got people from other NHS organisations who are interested about moving and looking at roles at STH. And we've also got a number of people who don't work in the NHS but are interested in looking at what STH and the NHS can offer. We've also got a mixture of people with clinical and non-clinical background. And so I wanted to say welcome to you all. You're all in the right place. We are really keen to look at the roles that we've got and offer them to lots of different people from lots of different backgrounds. So there is an opportunity, if we don't cover any of your questions today, to put those into the chat function, and at the end we'll pick up some of those questions and some that we've already received and hopefully answer those. But as I say, the absolute aim is to describe STH, describe the management opportunities that we've got, and talk about how you can get involved and apply for posts here at STH. So before I move on and welcome some of my colleagues, I thought it might just be helpful to describe who I am and my journey at STH. As I say, I am the Chief Operating Officer. I've been at STH for 23 years now. I came to STH on the back of the NHS Management Training Scheme, which is a graduate programme moving individuals onto management roles. I did that with no desires or plans, to be perfectly honest, to have a career in the NHS. I thought it was a long career in the NHS. I thought it was a great opportunity. It was a right next step for me at that time. But obviously, once I joined STH and once I became a NHS manager, I clearly and have really enjoyed it, found it very, very fulfilling, and in particular, enjoyed it working at STH and haven't moved on from there since. What I have done is worked in lots of different roles across STH. I started, my first role was the manager of our accident and emergency department at the Northern General Hospital. I've worked across medicine, cardiology, cardiothoracic surgery, and the Chief Operating Officer role. And I think that does show, and you'll hear from different colleagues who've had different opportunities and different pathways, that there are different ways into this and lots of different roles at STH. And I think the main reason I enjoy working at STH is about the breadth of the team and the different individuals that I work with, some fantastic clinical professionals, leadership professionals, and clearly a very challenging role, a very challenging time to be a manager in the NHS, but also a very rewarding role. So moving on to my next slide, please. If I give a bit of an overview of who Sheffield Teaching Hospitals, or STH as we refer to it, is. So we have got 5 main sites here in Sheffield: the Northern General and the Royal Hallamshire, the 2 main general hospitals. We've got Weston Park Cancer Hospital, Charles Clifford the Dental Hospital, and Jessop's Wing, which is the maternity hospital. But we also are an integrated acute and community. That's quite unusual for trusts across the country. So we do provide community services both through a number of different sites across the city, both our sites, so places like Firth Park Clinic, but also out of a number of GP surgeries and also in patients' homes. So a real mix of different services. Next slide, please. We're a very, very large organisation, so over 18,000 staff and a budget of 1 billion does put us in one of the largest trusts in the country. We provide healthcare services both as a district general, so for the services for the patients in Sheffield, but I'll come on and talk a bit about the services we provide regionally as well. But as well as healthcare, we also do teaching, education, and a significant leader around medical research. Next slide, please. So as I say, we are the hospital in Sheffield as a district general, so provide a whole range of services for Sheffield patients to access, but also provide some very complex, what we call tertiary services for South Yorkshire. So Barnsley, Rotherham, Doncaster refer a number of their patients on to us, particularly across cancer and some of the more complex clinical services. But we're also a regional and national provider for a number of specific pathways and take patients from across the whole country. So a very exciting place from that perspective in terms of the very different range and mix of services that we provide. Next slide, please. And so having described STH, I thought it might be helpful for those that aren't familiar with the structure of STH to describe about where the management roles fit and how our structures are. So we have 12 clinical care groups. That's how we've divvied up the organisation, and within that we have 27 clinical directorates. Each one of those is led by a clinical leader, usually a medical consultant, but is supported by both a managerial operations director and a nurse director. And that triumvirate is really important in terms of how we provide clinically led services, but bring that nursing and operational management element. But we also have a number of corporate departments as well, which again has operational opportunities in, and they cover things like finance, human resources, our governance and corporate teams, organisational development, communication, those kind of things. And we'll come on and talk about some of those different roles. Next slide, please. So finally, just to finish on the kind of the opportunities, and we hope that if you are interested, and at the end of tonight you will be interested in a role or a new role or a different role at STH, we're really keen that that's the start of your leadership career, management career. And let's just describe some of the opportunities that we've got around individuals starting within service manager, project manager roles, but then moving on to more senior roles within the organisation, and some real opportunities to move around the organisation. We'll talk at the end about the roles that we have got available now and likely to have available in the future. But to give you a flavour, so hopefully you can see the context that we're describing, roles such as operational management and service management, which is about running or leading a particular service, particular project management or programme management roles, which might be about coordinating a project or a programme across a number of different teams or in a particular pathway. But then also some of those project management roles sit within corporate areas as well and provide support to a number of different clinical areas. So lots of different opportunities, and I'm really pleased to first of all introduce Richard Maxted, who will introduce himself but describe some of those opportunities and the leadership pathway that he's taken to get to his role now. So Richard, I'll hand over to you. Thank you.
Hi there, Mike. Thank you, Michael, for that introduction, and hello to everybody on the call. So I'm Richard Maxted. I'm currently the Interim Operations Director for Specialised Cancer Services, which is one of the 12 clinical care groups that Michael talked about. My background was started outside of the NHS. I did a kind of undergraduate degree, and then my first job was working as a front of house receptionist in a small high street recruitment agency. Just doing initial interviews with people walking in off the street looking for work. And then I did admin and clerical roles in local authorities, supporting sort of service reviews, which gave me a real sort of opportunity to look at how different services worked across organisations, whilst, as I say, predominantly being an admin and clerical role. I then did a master's degree and actually decided to focus on becoming an HR professional. So I did all my HR qualifications and worked as an HR professional, both in private sector, in the charitable sector at the National Trust, and then also did a short stint in the NHS on a regional training scheme, not the national training scheme within HR, before moving to higher education, which brought me to the University of Sheffield, and that's what brought me to Sheffield. And I found very much that whilst I enjoyed my HR career, I was sat in a lot of management meetings and I was fascinated by a lot of what the managers were doing. And I thought, actually, my interest is probably broader, and I'd like to see if I could expand my range of skills and take up a sort of general management, operational management role. And I was lucky enough to join the trust in 2010, was given an opportunity by the eye clinic, service manager in the eye clinic. And I've been here for the last 12 years and done sort of 4 roles. So I started off in the eye clinic managing what I thought was a great place to start. I thought I'll start in the eye clinic. Eyes, they're quite small. That'll be a small department, not realising, of course, that most people have 2 of them. So that's double the workload to start with. And when you actually get into the numbers, 120,000 outpatient appointments a year, 5,000 plus surgical procedures, 12 subspecialties, lots of kind of input in terms of imaging, and working with very specialist services around artificial eyes and kind of optometry, and working with the community. Actually, it's a very, very, sort of a broad role and lots to learn there. And I had an opportunity while I was there, started off just as an assistant service manager, moved to deputy service manager, had an opportunity to act as a service manager, and then a role came up at the Jessup Wing Maternity Hospital as a service manager, and I moved there. And again, totally different range of challenges, but fantastic opportunities. I worked across obstetrics, both in the kind of acute setting of sort of labour ward and the kind of antenatal process, but also the community elements of community midwifery. Neonatology, which is around looking after babies that are unfortunately critically ill at an early point in their life, and the interface with the Children's Hospital, again, a really fascinating area to be involved with. Gynecology and women's health and the importance of women's health, and I was, coming to the role, a man going into an area which is quite focused on women's health, and that was not a problem or a barrier to myself. Worked really well with the team, was welcomed, and a fascinating part of my time at STH. Services across IVF and andrology, which is a kind of laboratory-based service. So even within each of these roles, quite a breadth of opportunity to learn different areas, different skills, work with different people, different professional groups, and at each stage building in terms of that experience. I then moved to the Chief Operating Office as an Assistant Chief Operating Officer, working for Michael. And in that role, I had an opportunity to put in the Patients Booking Hub at the at Sheffield Teaching Hospitals, which essentially was bringing together a number of our booking services for our different areas to our different directorates into one location, so that patients had a more sort of standardized experience, so we could improve some of the quality of communications and things like that. Supported patient flow, so the flow of patients through A&E assessment areas into the wards through the pandemic, which again was another fascinating area of work. Worked in booking patients for critical care that are coming in for planned surgery and developing systems to improve that. And also working a lot around sort of patient communication. And then my latter role, which I've been in for barely 4 months, I think now, as an operations director, I've now moved to specialised cancer services, so now managing a regional service, so working across the whole of South Yorkshire. So four posts, each one I've spent about 4 years in each, but you can see the range of experience that I've had the opportunity to gain. And I think I was thinking, why is it that I'm still here after 12 years? What is it that's unique about STH? And I think the things that stand out for me is, it's a place where you can build a career. as well as just coming for a job. You know, there are opportunities. An organisation of this size, there will always be opportunities. I think the range of experience that I've had fantastic line management support and great mentorship, both formally and informally, from different colleagues around the organisation. There's good support for training and development. And you also have that fantastic interface with our corporate teams, be that HR, procurement, research, education, organisational development. All of those areas are there to support you in those kind of management roles. And I think the biggest thing for me that probably stands out is I've had the opportunity to both work at the cutting edge of a lot of medical areas at exciting times, and that can be both in the research interface as well as in the service delivery interface. But more importantly, I've had an opportunity to contribute to the services that are provided to the community in which I live. And I think that's massive for me. You know, it's fantastic to be able to work in a role where you're giving back to your own community. And having been a patient that's gone through the hospital as well in the last couple of years, it's good to see it from both sides and kind of see, when you're on the patient side of things, how the impact of what you do day to day on people when often they're at a vulnerable point in their life. So yeah, I've had a very good experience, and that probably summarises why I think it's a kind of a great place to work. I think I'm going to hand over now to the next speaker, Stacey.
Hello everyone, thanks for joining us tonight. My name's Stacey Galloway. I'm an Assistant Facilities Manager here at STH. I actually started my career at 16 years old, came as a fresh-faced teenager straight from school, and I started as a domestic assistant working on the wards, which was an excellent job. Really enjoyed it. The interaction that you got with patients, being able to even just remembering what they liked to drink, you could see it made a real difference. And then I was lucky at 19 to be able to undertake a supervisory MBQ, and I managed to progress into a supervisor role, managing around 50 staff. I then left and had children, came back in a domestic role, and again worked my way back up to supervisor. And then in 2017, I was lucky enough, after completing an Institute of Leadership and Management qualification, to move up and sideways into the waste management department, and I became the assistant waste manager for the trust. Worked there for 5 years, gained lots and lots of knowledge in different areas, but still working quite closely with the domestic services team, which is where my heart always was, due to starting there at 16. Progressed up through there and did an Institute of Leadership and Management level 5. This was all done through the trust, which was a great opportunity. Got lots of support from managers, really did want to progress me when I showed an interest in wanting to develop myself in the trust, which was really great. And then in 2021, I returned back to domestic services as an assistant manager. I've now been doing that for about 16 months. I currently manage around 200 domestic staff, and I'm undertaking a level 6 managerial course at the same time, because I do believe that constant progression is necessary in the NHS, and they will invest in you to do that. It is something that has been shown to me since I started at 16. When you work here, you're valued and you're seen as somebody that's important, and if you want to make a difference and work your way up, you can. I genuinely think it's one of the best places to work in Sheffield. I feel like you're making a massive difference. Like Richard said, you're supporting the community that you live in, and every role makes a difference. So whether it be from a domestic to a porter to a catering assistant, every single role that is involved makes a huge difference. And being able to manage that service and walk round my areas and departments and see the difference that my staff make it does make you proud, which is the epitome of the trust values. I think everybody's valued, everything that you do is important, and it's a great opportunity for anybody that wants to come into the trust, whether it be through corporate or a clinical background or wanting to progress in either of them areas. There's so much opportunity for you there. It really is about making a difference, and the trust will invest in you to be able to do that. So on that note, I'll pass over to my colleague Balbir.
Good evening, everyone. Thanks for joining us today. I'm Balbir Bhogal. I'm the Performance and Information Director here at Sheffield Teaching Hospitals. I think we all want to share with you kind of our journeys and our experiences, just so you get a sense of there's not one way into the organisation, but clearly there definitely are careers that can make a difference. And who do they make a difference to? I think when you do jobs like these, you make a difference to patients and the way care is delivered, but you also make a difference to staff, the people that you manage, the teams that you lead, the examples that you set, the way you support them in their development. The opportunities are endless in terms of the impact that you have and the difference that you make every day. That's definitely how I feel when I come to work every day. So what does the Performance and Information Director actually do? Well, working with the clinical teams that Richard and Michael have talked about, thinking about the way care is being delivered to our patients and making sure that we're delivering the best care possible for all our patients. But in doing so, being clear with our staff what is required of them, what are the standards that we're working towards, what is it that is being asked of us. Another important part of the Information Director's role is providing data within the organisation and also outside of the organisation, so members of the public get a sense of how's my hospital functioning, how do I get access to healthcare, how do I be comfortable that the care that's being provided is the best care possible. So I suppose that's what I do now, but where did I start? I started some 32 years ago, came out of university not being clear about a career, but being clear about one thing, and that was wherever I worked, that the work that I did made a difference and it had an impact. So that was the thing that I kept with me. Working in a hospital attracted me very much, so I started at Leeds Teaching Hospitals and worked there for 25 years in a range of different leadership roles. When I first started, I managed a number of people, so 45 people that worked to me, and as you're working out, how do you get people to do the things you need them to do? They're all different, they've all got different ideas. How do you bring them together? How do you pull a collective view, and how do you create a team where people are focused, people are engaged, and we all want to achieve the same thing, which is the best quality care for patients? In my journey at Leeds, I managed different teams, so people that operated the switchboard, people that worked in the libraries where we pulled case notes, healthcare records for our patients, people that booked appointments, people that answered the telephone. And I had the opportunity to set up different ways of working, so big change programs and bringing in new technologies, so new systems that would help us to book appointments or see where patients are. So quite a lot of variety, quite a lot of direction, and also writing policy. So how do we create frameworks where staff and our clinical teams understand what are the must-dos, how do we describe standards of care and be clear about how we deliver those standards of care. I came to Sheffield just over 7 years ago, and what brought me to Sheffield was wanting to continue to make a difference, but being clear about that taking leadership to the next level, having a wider impact across the organisation. When Michael described working in clinical teams and working in corporate teams, a lot of my leadership and management career has been in the corporate teams. So having a real helicopter view of the organisation, working across many of the areas with a view of how do we pull the organisation together in one direction moving forwards. In terms of what we do here in Sheffield and how we make a difference, it's building that administrative voice as well as the voice of the doctors and the nurses, and through the leadership roles that we're asking you to consider today, you have a big role in representing those professional groups of staff and giving them a sense of direction and a career journey. So a lot around motivation, a lot around job satisfaction, and a lot around setting that direction and standards and pulling the best out of people. STH is a good place for investing in individuals. The trust invested in my development. So, you know, psychology is very important to me. How do we work with people? How do we get the best out of them? I just completed a master's programme and graduated a week ago. So the development doesn't stop at a particular point. The opportunities are always there. They're always tailored to individuals, and they're always about bringing the best out of you. And when we bring the best out of ourselves, we can work on bringing the best out of others too. And in managerial and leadership roles, that's a key part of what we do. We actually deliver our work through others, and we do that in a caring, kind and compassionate way. And one of my colleagues, Stacey, I think, talked about the STH Proud values. A lot of us work here in the hospital because we believe in the Proud values. We care about our patients, we respect each other, we own the work that we do, we work together. We're really clear that we're here to deliver the best that we can do. But we've also introduced proud behaviours as well, so that we work with each other, we get the best for each other, and then we get the best for our patients. I can't stress that enough. I may have said it too much. It's why I work here. It's what I came to do, and I'm hoping that it's what some of you will want to do too, because we're in careers that make a difference. I'm going to hand you over to my colleague, Caroline, who's going to talk to you a little bit more about that development that's on offer for colleagues. Thank you.
Thank you, Balbir, and congratulations on your graduation. Hi everyone, I'm Caroline Eadson. As you can see on screen, my job title is Head of Quality Improvement and Leadership Development. So I might just spend 1 minute just telling you a little bit about my background that I hope is helpful, and then just a few minutes, as Balbir said, just talking about what's on offer for you all really, and what will hopefully be helpful for you in these careers. So for me, I just wanted to share with you that I'm a therapist by trade. So I trained as an occupational therapist some time ago, I think 25 years ago. I've kind of stopped counting, but I suppose I still see myself as an OT really. I've not worked clinically for some time, but it's still part of me and part of my identity. And I was thinking, even while you were all talking just then, about, you know, what is it for me that still kind of keeps me really motivated and why I still enjoy my job. It's a different job. I've kind of gone down a different route. And I think it's just, this sounds ever so cheesy, but it's all about the people. So it is just about working with people for me, you know, whether it be patients, relatives, visitors, colleagues, teams, etc. It's kind of all about the people. So I wanted to talk about you all and perhaps what might be on offer for you. So if you don't mind just popping the next slide on, please. This is just to give you a bit of a flavour really about some of the leadership development offers at Sheffield Teaching Hospitals at STH. Now, I know there's some small writing on there, and this is just to give you an overview rather than for you to read all the detail. But that LEAD that you can see there, that logo is for our framework for leadership development, and it really is rounded in approach, so it addresses all elements of what it means to be a leader, leading through others, thinking about the environment you work in and navigating through the organisation and the systems. A is awareness of yourself and others around you and how to really develop that. And D, deliver and improve, and you know, how do we think about this continuous improvement while we work? So the kind of image you can see on screen is an example of one of the offers that we give, and it's an induction, really. It's called a Lead New Managers Programme, and we've only started this fairly recently to try and help people who are either new to management overall or new in a managerial role at STH. And the idea is that it just gives a bit of support to help you do your job, I guess. So to connect you in with a cohort of people, to be able to have a little bit of just sort of help from others in a similar position to work your way through that first 6 months in post. And some of that is some training. So you come together for a 2-day course about improvement at the beginning of this. Some of it is online learning modules. Some of it is reflection and just thinking about how it's been and you know, what's worked well for you, and sharing that with some others as well. But I just wanted to mention this as one example. But the overall leadership development offer at STH is really varied. So some of it are quite immersive courses, quite in depth. It might be a qualification like Stacey's mentioned, Institute of Leadership and Management, or master's modules, or whatever it might be. Some of them are really just kind of a toe in the water, just something quite you know, easy to access. It might be just a short module, something that you can pick up to kind of help you do your job, and something that you might enjoy and to help you develop. So I suppose the message is that there's quite a range, and it can be quite bespoke to your needs, really. And then another thing that I just wanted to mention, if you could just pop the next slide on for me, please. Thank you. Again, I really don't want anybody to read all the detail on this screen. You'd have a job. But this is the framework that Balbir spoke about, our Proud Behaviours framework. And this is relatively new to the organisation. So we've always had for about a decade had the Proud Values. And this is the next step that we developed through speaking to a lot of different people, staff and patients and visitors and relatives, to really define what do these values look like in action, and really describe them in behaviours framed around these Proud Values. So again, you can't see all the detail, but I wanted to just share this with you to say it really is about what values you hold and what you bring. So it's all about being kind to each other, really, I suppose, being, for want of a better phrase, being a decent human being to each other and helping people to help others. So this is just to let you know that this framework exists, and hopefully it will help us to sort of really live in these proud values all the time. And this is going to be launched to our patients and visitors in the very near future. So I just wanted to touch upon that for you as well. I think that's probably about it from me. Hopefully that's given you a flavour. And now I believe I'm going to hand over to Debbie, who's going to tell you a little bit more about some of the benefits of working at STH. Thank you very much.
Hello everyone. Absolutely delighted that you're here with us tonight, and thank you so much for doing this. From an HR point of view, absolute delight to be able to take you just behind the scenes for those few moments to show you the commitment, the passion and the leadership that really drives STH day in and day out. If you've been inspired, or you're even mildly interested in any of what you've heard tonight, I think we'd be liking to engage with you and have some more conversation about that. So let me just tell you some of the other little bits and pieces as well. So next slide, please. As well as the career opportunities you've heard, there's also some important things about how we look after you. If you're here looking after our patients, we want to make sure that we're looking after you as well. And STH in the last few years has really strengthened its offer to your work-life balance. So we've got a platform which is known to us as VivUp, and through that you can retrieve great staff benefits, discounts on shops, restaurants, attractions, to make your working world easier and your home life balance easier. If you're not from the NHS, you may not know that we've got full part-time flexible working opportunities. We've got good annual leave programme, and we've got a good NHS pension scheme as well. We're really committed to supporting people through the whole employment journey, whatever age you are. There's something in this package I think that we can offer you and support you. So we've got NHS pension scheme guidance, we've also got flexible retirement schemes, we've got career breaks, and we've got our new wage stream, which helps people manage their finances by accessing wages within the month as well. We also have, and are fortunate to have, our own on-site nurseries, so we actually manage them directly, and we have spaces available. Moving sometimes when you've got children committed to nurseries and education is never easy, but again, if that's something you'd like to talk about, very happy to have that conversation. The training and development we've talked about quite a lot, and that's really is structured throughout all posts, and we've got such a range of opportunities here in the trust. And we've got a 24-hour wellbeing and counselling support. Not to say that everybody needs that, I'd just like to say that, but we've got people's health in mind. That's your physical health, that's your mental health, that's your wellbeing. It's all around package that we want to make sure all of our employees are supported. You can find more from all these details on our staff benefits booklets, and that's available on our website as well, of our Brilliant Place to Work. So don't hesitate to have a further look if you'd like to know any more about that. On to the next slide, please. The next steps. If you are interested, if you feel in any way this might be something for you, then take a look at our website. Do think about using our email address, which is at the bottom there, sth.jobs@nhs.net. That's monitored every day by the HR team. So if you've got a particular question about a particular area or your skill set, you're welcome to drop us a note, and we'll get back to you as soon as possible. And what we want to do is try and put you in contact with the right people as well, who can give you some perhaps specific advice that you're looking for. We will continue to publish all our vacancies on our Brilliant Place to Work website. And that's also feeds into NHS Jobs, so continue to watch that site, and you can also form a link with NHS Jobs so you get bulletins as well. If you type in the keywords, you can register, so you're notified directly when we publish types of vacancies that you're looking for as well, so that feed can keep going. We've been gathering all our vacancies at the moment, ready for publishing, so more will be appearing during the course of the week as it moves on. So I think that's all I need to say at this point, but very happy, I think, to move on and take any questions.
Thanks, Debbie, and thank you to everyone for your contributions there. So I think what we'll try and do now is I'll try and pull together some of those questions that you can see in the published chat, and also some of the ones that we've had before. I'm not going to, unfortunately, I don't think I'll have time for all of them, but we'll try and capture 2 or 3 with each of our different responses. So I think there are a number of questions in there, and questions that we've had before, which are really helpful to hear and really good to hear, which is kind of, let's get down to the nuts and bolts of how do I describe transferable skills if I'm an interested applicant, and what might we be looking for if your background isn't the NHS or you're external to STH. So I'm happy to start on that, and then I'll probably pull in a couple of colleagues as well. So you've heard a couple of colleagues talk about particularly the proud behaviours, and both Balbir and Caroline ran through that, and it genuinely kind of, we've all got it on our background about proud to make a difference, and that is it's not just written there, it's something we truly believe in. And so proud is about putting the patient first, respect to one another and our patients, ownership in the tasks and things that we do, unity, so working for a team, and delivery, really kind of focusing on how we do make that difference for patients. And so one of the key things we absolutely look for are those values and behaviours across individuals. So I think being able to describe that and looking for that in applicants is key. I think then it is about, we know people will be moving from clinical areas, from corporate to operational roles, from operational roles to corporate roles, and so we genuinely want to help you with that process. So Debbie kind of described there some of the contacts, and we're really keen for you to make contact with us if it is about how can we help you as an individual to make an application. But I don't know, Balbir, if I come to you, you've appointed a number of different people at STH and in previous roles from clinical, non-clinical, STH and other backgrounds. Is there anything you wanted to offer up there?
Yeah, thanks, Michael. What I would say, because I think the questions that were being asked there, when you're looking at the recruiting manager, I think having a conversation, I think is really important, and being clear about the values that you bring and how they align with STH values, and being clear about when you're looking at the job descriptions and the person specifications, where you think the knowledge gaps are, but what have you done with within your own industry that's maybe similar, so we can look for the parallels. And I suppose one of the key things that when you join the NHS and you join the hospital, there is a set of language that you need to learn, and the challenge for us is how do we get you up to speed quickly around our policies and the standards and the deliverables. But if you can tell us where your skill set has been, which is what we've done with some of our recruitments, we've been able to tailor the inductions for the individuals that we brought in and then bring them into the organisation more successfully. So, and that focus on your transferable skills around managing teams, motivating people, and how do you work with people? How do you set goals? How do you monitor how people are working? How have you got good communication skills? Every leader needs to bring that into every industry. We kind of just need to work out where your knowledge gap is and then how we would work with you to plug that knowledge gap. So opening up that two-way dialogue, don't be put off and be persistent, because we're looking for you and we'll work with you. Thanks, Michael.
Thanks, Balbir. And absolutely, we are genuinely, that's why the team is here today, keen to work with individuals and support you. And Debbie, am I right in terms of some of the things we then offer around CV and application writing as well?
Yeah, there is support there, Michael, for that as well, that we can offer guidance on how to, marry up the person spec and what to include and focus on thrive values, certainly, yeah.
Brilliant, thanks, Debbie. A couple of other questions then are around flexible working and working from home, and all of these posts do have where we can match the post and meet the needs of the service, the opportunity for flexible working. We do have posts that are full and part-time, and a number of us are now. I'm sat at home now as I kind of describe this, do home working in the day, and again it's that mixture of home and office space, but also being out and about in our services. But Caroline, I don't know, I know your team has a number of varied roles and different ways of working. Is there anything you want to add just from your personal perspective on that?
Yeah, sure. About flexible ways of working, Michael.
Yes, and working from home, both.
Yeah, sure. Yeah, I mean, so from personal experience, I work part-time, if it's helpful to know. So you can do different jobs on part-time or full-time roles. I work 4 days a week, and yeah, across organisational development, we have a bit of a rolling rota, lots of flexibility. So some people being in the office, some people being in and around the organisation, some people working from home. The courses and things that we offer, as I mentioned earlier, like the LEAD programmes, some of those are face-to-face, in person, in the training facilities that we've got across the organisation, and some of those we run virtually, and we try and strike a balance, because learning sort of through the pandemic, some of it was great to enable a bit more quality of access for people being virtual, but then obviously some elements were missed by people, so we tried to do a bit more face-to-face. So I think just a blend across, and just open-mindedness, and just testing. The whole philosophy of improvement that we have at STH is about sort of testing something, learn from it, and see how it goes. Hopefully that's helpful, Michael.
Really helpful, thank you. And I think again it is that, and we genuinely mean this, looking at different opportunities that we can offer, and come and talk to us if there is a particular way of working or a structure that works for you. We are a 24/7 service, we are across 5 sites, we are acute and community. It does facilitate a number of options. There's then a number of questions that, reading through, look like they are from STH employees around how they might access different development courses, particularly the ILM, and the need for management qualifications or degrees. Stacey, would you like to add anything on that? I know you kind of gave your personal experience around your ILM, but then also in terms of your recruitment, but also your personal experience about how individuals access some of those development opportunities?
Yes, of course. Mine were all done, well, my ILM3 was done internally through the trust. We have people working up at our Rivermead Centre at the Northern General site that deliver that course. So I was given time off to attend that course. I was given time to complete the essay sections of the course by my managers, so that I could progress forward with that. The ILM5 was sourced through a similar route, but was provided by an external training provider, but that worked quite closely with the trust. So that was managed to be done, and that was a little bit of everything. Some done from home, some taken time out in work, tutors that came on site to assess you in your roles. It was really beneficial, and the level 6 has been quite good because I'm doing that in management and waste management. So I'm still keeping my hand in the waste sector, so that I've still got them opportunities there should they become available in the future, to still have that knowledge, the legal framework. But we offer lots of different courses in domestic services to our supervisors. We still do the supervisory courses. We've currently sourced the Edward Jenner for our supervisors to help them progress up the corporate ladder. So there is lots of opportunities within the trust. You just have to want to push yourself that bit more and find out where we can get them from.
Brilliant. Thanks, Stacey. Really helpful. And Caroline, there's also a question there about the LEAD programme in particular. Do you want to just give an overview about the entry requirements and how individuals can access that? I know that's very specific internally within STA.
Yeah, of course, very happy to. So the answer is yes, people can access these courses. That's the short answer. I'll try and keep this brief. So I think we have different options for people's needs. So like I said before, there are like standalone modules, which we're working on these more and more, but there are a number of them which I'd really encourage anybody to access, and you can do those kind of at various given points, but they are open access to anybody at STH. So they're called LEAD Essentials, and they're a bit of a pick and mix. Now, some of the programs like the LEAD New Managers, I think they are a bit of a program made up of those LEAD Essentials, but to bring people together, if that makes sense. So it doesn't mean that you can't do one of the modules as a kind of standalone, but we do try and sort of piece them together as a bit of a package for particular roles, not intended to exclude people, but intended to kind of package it up for somebody who's already in post. Having said that, we are, again, like I said before, testing and learning different ways of doing things. So an example would be we run a programme for clinical directors and clinical leads, and some consultants have asked, oh, could I do this thinking about my next role that might be a clinical lead? So we're testing with a handful of people and learning from it. So I'd say always open to the conversation, certainly for the formal qualifications as well, like ILM. Yes, we've run different ones for different either professional groups or for sort of open access to people as well. So we're trying to just keep it as broad as we can, so we don't exclude.
Brilliant. Thanks, Caroline. And then to try and wrap up the last couple of questions, we've touched on it a bit in terms of transferable skills, but some questions in there in terms of individuals who are in corporate roles and interested in operational roles or vice versa. And Richard, you described your HR background, but then kind of going from a clinical service into corporate role and back out again. So anything you just want to kind of add on those questions, Richard, please?
Yeah, thanks, Michael. I think what I would say is people that are transferring from corporate roles into operational roles, within that corporate role, you have a lot of skills inherently within the role that you're doing, and a lot of those are going to be transferable to a different environment. As Balbir mentioned earlier, there may be some knowledge that you would need to learn within that new role. But essentially, when I moved into operational, my first operational role, a large part of that was managing the admin team. And I'd already managed HR administration teams, so in that sense I could bridge that gap. What I didn't have was some of the knowledge around how do you look at sort of demand and capacity and services and things like that, and you can learn that. But I think the other thing that I would say to people is if you are in a role and you're interested in making that transition, don't wait to the point of application to start to prepare. Try and find out more about those roles. See through the appraisal process or conversations with your managers, can you go and shadow somebody? Can you find out a little bit more about it? You can be active in a current role in terms of gaining skills, experiences to prepare you for that next role when it comes, rather than getting to the point of application and thinking, I really want to do this, but actually I'm missing X or I'm missing Y. Is there any way you can get some exposure to that within those roles? And ask to shadow people, find out more about it, find out that is definitely what you want, and then ask them, well, I've been really interested by what you've shown me today. If I was sitting in front of you at an interview panel, what would you be looking for? What can I do between now and then? So I think there's opportunities to be proactive, but if you're in the corporate sphere, move into the sort of frontline, sort of clinical operations type stuff, or the other way, you have an existing set of skills. So I think it's about really making clear what those are and how transferable they are, and seeking those opportunities to fill the gaps, get the experience and that sort of thing while you're in post ready for the next one.
Brilliant. Thank you, Richard. Now, I'm acutely aware I've not addressed each and every question, so I'm really sorry about that, but please do get in touch where there are specific questions. We've shared the email address, and I think we'll share that again, or we'll put that in the chat so that you can get in touch. I suppose what I'd want to do now is just kind of wrap up and thank you all for joining us, as I said right at the very beginning, and engaging today. I hope what you've done is hear just how passionate some of our leaders are here at STH, and I want to reassure you that that does represent the leadership and the management community. We are all very passionate about providing healthcare and supporting our clinical teams and our administrative teams to deliver really good, high quality healthcare. We really do feel proud, and those proud values are really prominent and eminent across the organisation, and there really is an opportunity in these management roles to make a difference for patients. So if you are interested in those roles, we will send out the details of the roles that currently are vacant now. I think there's at least a dozen or so that we know we've got vacancies at the moment, and because of the size of our organisation, there are different roles coming up all the time. If this is your first time that you've looked at a role at STH or in the NHS, and you are one of those people that are unsure about how your skills transfer across, or the types of roles or the bands of roles that you think best match your skills and experiences, then do please get in touch. We're really keen to help you with that. We've got lots of experience of doing that. And I know one of the questions was about what bands are we talking about here. So for those that are familiar with the NHS, then for me, this is across all bands. So leadership and management roles start at Agenda for Change 4 and work the way up. When we talk about service and operational managers and project managers, that's band 7, band 8As, and then we get on to 8B and 8C roles when we talk about the assistant chief operating officer and the deputy ops directors. We really, hope that we can work with you and support you all, so that we can get you into one of these posts. And hopefully, if we're doing one of these events in a year or two's time, then some of the people that have been here listening to this will be on this side of the presentation talking about their journey transitioning to STH. So thank you all for listening. Do follow up, do ask us any questions. We're really keen to support you. Hope you all have a good evening, and I really hope to meet you soon. Thank you ever so much. Good night.